We do feel like that she should still be here. The situation wasn't handled. It could have been handled definitely different. I don't feel like the necessary steps that needed to be done, far as contacting caseworkers, contacting family members, or even sending crisis prevention officers to her location to even attempt to de-escalate was done. So yeah, there was definitely some procedures that we feel like were failed, and she.
Welcome to the Dr. Dare Show. My name is Dr. Frederick Dare. I am a therapist here in Atlanta, Georgia, and welcome to my channel. But before we get started, make sure you subscribe to my YouTube channel. Yep, subscribe, like this video, share it, and click the little bell at the bottom of the screen so that you will get updates of when I upload new content. We usually cover hot topics or mental health issues. Today is no different. Today our topic is veterans, mental health illness, and police do not mix. The Crystal Ragland story. Again, that topic is veterans, mental health illness, and police don't mix. The Crystal Ragland story. So let me just give you a little background. So May 2019, Crystal Ragland, she was 32 years old at the time. Location, Huntsville, Alabama. So in May 2019, on a Thursday morning, there was a 911 call. I'm not sure who that came from. I read different stories that it came from the neighbors. I read different stories where it came from the apartment complex manager, but I'm not sure. Not here to really talk about those details. But so there was a call stating that there was a woman waving a gun, and people were kind of nervous. I read something where it said she was waving a gun or pointing a gun at somebody. But again, like I said, all of that is allegedly. I don't know all those details because every time I would go to a different article or read a different article, there were different details there. But that's not why I'm here. And so, Crystal Danielle Ragland, 32 years old, was a veteran, and allegedly her family and some other people were saying that she suffered from PTSD and schizophrenia. And that was her sister on that clip. That sound clip that I'll let you hear at the beginning of this video. And so let me get back into the story. Sorry, I'm always all over the place. So allegedly the 911 call was made. The police arrived. There was Crystal. The reports that I read said the police officers knocked on the door, but Crystal came out of another door. All of that's what I read allegedly. And shots went out. I guess the cops were saying that she didn't respond to their commands when they told her to put down the gun. I read a story where they said the gun was fake. I don't know all of that, but again, just trying to give you the background of the story. The end result is Crystal was shot and killed by those police officers. They were put on administrative leave for a little while and then cleared of all those charges. But that was Crystal's sister on that sound clip that I'll let you hear, and she was saying that things were not handled properly. She felt that, a case manager should have been called, or a family member, or someone that could have probably de-escalated the situation. Maybe if, one of them were there and Crystal recognized their voice, that could have triggered her to, calm down or de-escalate the situation. And maybe, because we don't know what triggered Crystal into this episode that she was having, and her family feels like, maybe one of them could have talked her down or talked her out of it, or a caseworker that she has been working with. But there was a lot of stories of Crystal and strange behavior throughout the neighborhood, but that's not why I'm here. My question is, how are the police officers handling, mental health patients? Because there are a lot of veterans and a lot of U.S. citizens that have mental health issues. And actually 1 in 5 U.S. adults live with some type of mental illness. That's 51.5 million, and that was in 2019. And this information came from the National Council for Military Personnel Behavioral Health. And also that, people with mental health illnesses are 16 times more likely to die by the hands of police officers when they interrupt them. When they interact with them, just like with Crystal's case, they came to respond to this call, and the patient had a gun. And so my question was like, what is the training for police officers when they encounter someone that has a mental health illness? And is there a time where, like, if you live in a certain area and you have PTSD or you're schizophrenic, is there a law or something that requires you to report that to, like, if you're living in an apartment complex, you report that to the apartment complex, or something like, like sexual predators, they have to register in their neighborhood or in their county or however that works, so that you know that they're there. I thought that would be a good idea for veterans or people with mental illness, is that the police officers know that you live in this house and that you have a mental illness in case there is a call like this situation. I know that, what's his name, Lieutenant Johnson said the Huntsville police officers are trained to handle mental health issues, but when a gun comes out, that changes the dynamic of the situation. And I understand that, but what are the next steps? Is it just shoot to kill a person? I'm asking. I don't know. No judgment on any part. And I just feel like maybe, but Crystal's sister did say that the apartment complex knew that, Crystal had a mental health illness. The police department, she said, they knew. So why not have sent like a caseworker or contacted the family right away before taking that result? And I know it was in everybody, energy and anxiety was high, and, logical thinking may not have taken place. But my thing as a mental health therapist, I'm wondering, how is that handled in each state? Because there's a lot of people with mental health illnesses, that may get caught up in this same scenario, and our veterans deserve better. Rest in peace, Crystal, and thank you for your service. Thank you, all the veterans out there, for your service. So I just thought, since last Wednesday was Veterans Day, and I saw that's how I stumbled upon this story, is that I saw her sister talking about how hard it was, and that Crystal should still be here. And it's almost like I feel like our system, we don't focus on mental health illness. I think a lot of us are afraid when we see someone that's schizophrenic or talking to themselves or something like that, and we don't understand it, which in this case probably contributed to the calls that were made. But if the police could have, I don't know the protocol. I know what Lieutenant Johnson said is that the cops, once a gun is involved, that changes the training. But what does that mean? Like, any cops out there that's watching this video, chime in and let us know what that looks like. If somebody has a mental health illness and the cops are called on them, should you have their caseworker contacted? Should the family be contacted? How does that work in the police department? Because, again, there are a lot of mental health people out here. Like I said, what is 51.5 million people, 1 out of every 5 adults in the United States suffer from a mental health illness. And being a therapist, I know things can trigger, like something must have triggered Crystal to have this episode. Maybe someone being called could have, de-escalated the situation. We don't know. But what does training look like? And does my idea make sense, or is there HIPAA violations or privacy violations that prohibit people notifying their neighborhood that they have a mental health illness? Because what if you have an episode and you're walking in your neighborhood and you're talking to yourself or something like that, and then your neighbor gets scared and calls the police, and then this scenario keeps happening over and over again? We have to do better by our veterans, because they're serving our country, they're protecting us. So the end result shouldn't be them dying because, you know, they're mentally ill, you know. And I know a lot, again, like I said, a lot of people don't understand mental health illness, but it is a real thing and it does happen. And a lot of military people do suffer from PTSD because they see things that are very traumatic, and that experience just it imprints on their mind, and then they may have flashbacks, they may have triggers, and then if you're schizophrenic, you may have hallucinations, or you know, you may talk to yourself. Those are things, and I know they're scary for people who don't understand it and recognize it. But I think if you're aware that John Doe down the street has PTSD or has schizophrenia, then you're more likely to say, okay, I understand that he's sick, you know, even to the point of maybe providing neighbors in that community with family contact information or caseload. I know that's a lot of work, but, you know, or just having the police have that information. So when they are called about that person, send the family first. Even if that gun situation happens, let the family know, you know, your daughter or your sister has a gun. Maybe you can go de-escalate with us as a team, not sending, because I know the cops are not going to send anybody out by themselves, you know. But I don't know all the protocols. I'm just here trying to spark this conversation up for our veterans and for our mental health, mentally ill citizens, because they're out there and it's happening. And especially like with this pandemic and all of that stuff, it may be creating, this pandemic is traumatic for some people, and people may, you know, suffer from mental illness, or it may get worse because we're being isolated in our homes, which could be a trigger. You know, it triggers my anxiety staying in the house, you know, with no like deadline when this stuff is over. So I can imagine someone with you know, the more severe PTSD and what are your thoughts out there? You know, I'll keep talking and talking and talking, but what are your thoughts? What do you think are the solutions to these problems? What training do you think cops need? What trainings do you think the citizens need to know, to recognize this? Let me know your thoughts. Thank you for watching. Like I said, I can go on and on and on and on and on, but thank you. Have a great weekend. Have a great week, and talk to you later.